diarrhea may seem harmless, but in the world, more than 1 million people die because of diarrhea every year. That's why we will discuss how to correctly spot the cause of diarrhea and treat it promptly. The simplest definition of diarrhea is when a person has loose stool more than 3 times per day. Most diarrhea is minor and due to food poisoning or a mild viral infection. These are occasional and temporary, but we take diarrhea seriously if it lasts more than 2 days in adults and more than 24 hours in children.
Diarrhea always requires attention, especially in children and in the elderly who are more vulnerable to fluid loss. The most common scenario of diarrhea is food intake. Foods often contain different bacteria or viruses. They can irritate the intestines and cause inflammation. At that point, the intestines stop absorbing water and nutrients. Also, irritation causes intestinal spasms and non-absorbed content is released as loose stool. If the inflammation continues, water secretion into the intestinal lumen can persist. This can lead to watery stool. Not only infections, but also food intolerance is a common cause. Medications like antibiotics, metformin, laxatives, or magnesium-containing antacids often cause diarrhea. Another common cause of diarrhea is irritable bowel syndrome with diarrhea, which affects almost 10% of the population. Women are more commonly affected. In this condition, stress, certain foods, and altered gut-brain communication trigger diarrhea. It often appears chronically after stress, after certain foods, and generally after eating. Before diarrhea occurs, there is abdominal pain that goes away after defecation. Inflammatory bowel disease also causes diarrhea, especially when there is bloody chronic diarrhea. In that situation, there is a high probability of ulcerative colitis. Another common cause of diarrhea is viral gastroenteritis, also called stomach flu. It is caused by viruses, usually norovirus and rotavirus. It leads to diarrhea, which can be sudden or gradual, along with stomach pain, vomiting, and nausea. These symptoms may last for several days, sometimes a whole week. If diarrhea starts abruptly and causes a high fever more than 39 degrees Celsius or 102 degrees Fahrenheit, there is a high probability that it is bacterial diarrhea. In this case, stool can be bloody or contain mucus, which is called dysentery. It is commonly associated with the intake of undercooked meat, poultry, or eggs. Common pathogens in this situation are Escherichia coli, Salmonella, and Campylobacter. Many other factors can also cause diarrhea. For example, parasites like Giardia lamblia or Cryptosporidium, especially when the person has recently returned from a trip to a developing country with persistent diarrhea. Antibiotic-associated diarrhea is common when antibiotics kill good bacteria in the gut, allowing Clostridium difficile to grow. This can cause fever, abdominal pain, and diarrhea. Other bacteria can also be responsible even if syphilis ruled out. Celiac disease, which is gluten intolerance, or lactose or fructose intolerance, can also cause diarrhea. Sometimes the underlying cause is more serious, like colon cancer, but this is much rarer. The first-line treatment of diarrhea is oral rehydration solutions. It is the gold standard of treatment. These are usually specially formulated packages containing salt, glucose, and electrolytes designed to replace electrolytes lost during diarrhea. If these solutions are not available, you can prepare one at home.
Mix 1 liter of clean water with 6 tablespoons of sugar and a teaspoon of salt. Stir until dissolved and sip it slowly throughout the day. Additionally, zinc supplements 10 to 20 milligrams daily, especially in children, help reduce the duration and severity of diarrhea. Diet should be light and easily digestible, often referred to as the bread diet. This includes bananas, rice, applesauce, and toast. As a general rule, low fiber, soothing foods that are gentle on the stomach are recommended. Avoid drinks high in sugar, like soda or fruit juices, as they can worsen diarrhea. Also, stay away from alcohol and caffeinated drinks, as they can further dehydrate you. If diarrhea is not very severe, and there is no high fever or bloody stool, medications like loperamide A. This slows bowel movements and helps reduce frequency. Bismuth subsalicylate can also help with mild diarrhea.
If there is high fever, bloody stools, dysentery, or lab test confirmation of a bacterial infection, then antibiotics are used. Ciprofloxacin and levofloxacin are commonly used for Shigella, Salmonella, and Escherichia coli. Azithromycin can also be used. Azithromycin is the drug of choice for Campylobacter, Shigella, Salmonella, and multi-drug resistant bacteria. It is often preferred for children, pregnant women, or in areas with high fluoroquinolone resistance. Metronidazole is commonly used for parasites like Giardia lamblia and Entamoeba histolytica. For Clostridium difficile infections, vancomycin is used. Some studies suggest that certain probiotics like Lactobacillus rhamnosus GAG or Saccharomyces boulardii might help restore good gut bacteria, especially after antibiotic use. They can shorten the duration of diarrhea slightly, but they are not always essential. For children, it is important to keep them hydrated. Give small, frequent sips of fluids using oral rehydration solutions or homemade solutions. Watch for signs of dehydration such as dry mouth, decreased urine output, lethargy, sunken eyes, or crying without tears. If you notice these signs, try to give more fluids and seek medical help immediately. Use boiled water if no clean water is available, or use water purification tablets. Continue feeding even if children have diarrhea. They still need nourishment. Continue breastfeeding if they breastfeed, or give their normal formula or food in smaller, more frequent portions.